Which types of colon polyps are dangerous? Imagine your colon as a busy highway, and polyps are like small bumps or obstacles that can sometimes cause trouble. Not all polyps are harmful, but knowing which ones are risky helps protect your health. Let's explore the different types of colon polyps and which ones might pose a concern. The most common and concerning type are adenomatous polyps, also called adenomas. These are considered precancerous, meaning they have the potential to turn into colorectal cancer over time. Adenomas come in different forms based on how they look under a microscope. Tubular adenomas are the most common, but villous adenomas tend to carry a higher risk of becoming cancerous. Larger adenomas, especially those over 1 centimeter, are more likely to contain advanced changes or cancer. Studies show that about 75% of colorectal cancers begin from adenomatous polyps, making their removal an important step in prevention. Another type to be aware of are sessile serrated adenomas and traditional serrated adenomas. These polyps are also precancerous and can develop into cancer if not removed. They often look flat or slightly raised, which can make them harder to spot during a colonoscopy. Because they follow a different pathway to cancer than traditional adenomas, identifying and removing these serrated polyps is crucial for reducing risk. In contrast, hyperplastic polyps and inflammatory polyps are generally not considered dangerous. Hyperplastic polyps are quite common, especially in the lower part of the colon, and rarely turn into cancer. Inflammatory polyps can develop in people with inflammatory bowel disease, like Crohn's disease or ulcerative colitis. While these polyps themselves are usually benign, the chronic inflammation from the disease increases overall colorectal cancer risk, so ongoing monitoring is important. Some individuals have inherited conditions that cause many polyps to form early in life. For example, familial adenomatous polyposis involves hundreds of adenomatous polyps, with a very high risk of developing colorectal cancer if not treated. Other syndromes, like muti-associated polyposis, Peutz-Jeghers syndrome, or Cowden syndrome, also involve multiple polyps, some of which are benign but may be linked to increased cancer risk. These genetic conditions requiring specialized management and regular screening. Size and shape of polyps also influence their risk. Larger polyps over 1 centimeter are more likely to contain advanced changes. Sessile polyps with a broad base can be more difficult to detect and remove completely, which might increase the chance of missed cancerous areas. Polyps with high-grade dysplasia, meaning severe abnormal cell changes, are also more concerning and often lead to closer follow-up. In summary, adenomatous polyps and serrated adenomas are the types most associated with cancer risk. Larger size, flat shape, and high-grade dysplasia increase their danger. Hyperplastic and inflammatory polyps are usually benign but still requiring proper monitoring based on individual health factors. If you have a family history of polyps or genetic syndromes, your doctor might recommend more frequent screenings. Regular colonoscopies and prompt removal of suspicious polyps are key to preventing colorectal cancer. Always consult your healthcare provider for personalized advice and management tailored to your health needs.